Give the sepia tone, there might be a projector issue. Here, it's going to turn into full color as soon as we land in Oz. Okay. All right. I'll try that again. Welcome to the Nantucket Board of Health meeting for July, what is today, the 16th. This video is being audio and visually recorded. And the first course of action is to establish a quorum. So I will go, everyone here is in attendance. I'll start left or right. Just state your name and say here. Go ahead.
Ernie Strang here.
Kate Garrett here.
Bob DaCosta here.
Gary McKenna here.
We've established a quorum. We are currently one member down with a appointment coming up for the next meeting. In the interim, we're going to be establishing an interim chair just to manage this meeting. Just given the time that you're here, I'd like to suggest Carrie as the interim. He will serve only for this meeting, and then there'll be another election held when it's a full board in August. That would require both a motion and a vote to carry.
So moved.
Second.
And then now vote by, you can just do, everyone's in attendance.
Yeah.
You don't need to do by roll call. You can just say aye all in once.
All those in favor?
Aye.
Aye.
Okay, you're the chair.
Do I gotta move that chair? Can I do it from here?
You can move it over there if you like.
I don't want to.
You can stay right there.
I'd rather stay here. I'm all set up.
Yeah.
Okay, so let's see, we've like that election of officers is going to be, again, due to the fact that we don't have a full board, we're going to hold off on that till next month.
Yep.
And so what next thing would be public comment. So anything that's not on the current agenda, today's agenda, any comments from the public? This is your opportunity to speak. Anybody online, John? Okay, public comment section is closed. The approval of minutes we are not going to do today from the last meeting. Reason being that three of the Bob was here and me, you folks haven't had you weren't at the meeting, you'd have to abstain. So this would give a chance for you folks and whoever is appointed at the August 5th meeting a chance to review the video and match it up. So the approval of minutes will occur of the June 18th meeting will occur at the August meeting. So that we're just going to, that's on hold. What we're going to do is jump to the director's update, and Jericho will cover that.
It's a relatively brief set of updates this month, and it is almost entirely about ticks. The Department of Health and Human Services started a yard survey program. We have an intern who is on the island who will be doing tick drags. We should have an online sign-up form. The tick drags are in your yard. They're to identify the type and number of ticks on your property, and then give you some advice about how to manage your risk exposure in your yard. Additionally, there have been a number of reports from Martha's Vineyard about the prevalence of a relatively new species of tick called the Lone Star tick, which carries a couple of tick-borne illnesses, but the novel tick-borne illness is something called alpha-gal syndrome. It is a tick-delivered allergy to proteins that are found in mammalian tissue, which includes red meat, as well as some cosmetics and medication. We've met with the hospital today because it's now a reportable disease. So we spoke with the hospital about reporting protocols and how to make sure that all the cases are tested and the necessary data is sent to the state for us to follow up on. Additionally, we'll be meeting with Dr. Leprie's office as well in the next week to do similar things to improve reporting. We've been working on a relationship with some public health organizations on Martha's Vineyard through the Inter-Island Public Health Excellence Group. Part of that includes an epidemiologist who is a specialist in alpha-gal, and we will be publicizing some virtual office hours that she does on a weekly basis to answer questions or evaluate concerns around alpha-gal syndrome. Likewise, there are a couple of work groups that are starting up to address tick-borne illnesses in general and the Lone Star tick in specific. If you're at all familiar with this, there have been Lone Star on the island for a few years, but they have been confined to certain regions of the island and or Tuckernuck specifically. This year, we're believing that they are more widespread than they have been in past years, primarily because of the drought status and the fact that the Lone Star tick is more resistant to dry weather conditions, which probably means it will establish a foothold in new environments on the island. The various conservation agencies on the island, Natural Resources and the Health Department are planning on working together on a couple of work groups, as well as connecting the other parts of tick population reduction with the venison donation program, incentivizing hunting, and working with conservation agencies on deer removal or deer damage removal permits with the state. Then the ongoing childcare pre-K subsidy program is underway. We have about 100 people, 100 children signed up for that. We will be continuing signups for that until the 31st of August. And then we will be getting back to people based on the number of people applied and the amount of money in the fund associated with it. We will be able to tell people who are eligible the amount of money they will be receiving is a pre-K subsidy. If you're unaware of that program, there should be a sign up online on the Health Department webpage. You can also reach out to the Health Department or to Human Services to get more information on that program. That's basically it. If anyone
There's a
has
new director?
yes, there was the announcement of the new director. It's Joanna Watson, formerly of the CDC. She will be starting this the end of August in this year. I do not believe her start date will be before the next meeting. So the first official introduction will likely be September's Board of Health meeting. Any questions on the tick stuff, the childcare stuff, or any other unrelated questions?
Jericho.
Yep.
Has anyone given any thought, besides killing all the deer, to reinstating pheasants and guinea hens to the island? I mean, from what I read, a guinea hen eats an awful lot of ticks in a day. And
so I remember when we had the guinea hen program here, and it was right around when Lyme and the deer tick started showing up. We've spoken with Dr. Sam Telford, who's one of the he's been dragging out here for 30, 40 years. He is unconvinced that tick populations are impacted by guinea hens in the numbers that are sustainable here on the island. His example, when I asked him about this question, like I think 6-7 months ago, is that when the guinea hens were first introduced to the island, they spread very quickly, very effectively. And then he ended up on one of his drags finding several guinea hen corpses, basically. And he said he had more ticks off of that than he did on a typical deer. So it's thought that they certainly can consume, but they also are an additional vector. It might be an issue of the necessary numbers of pheasants and the necessary numbers of guinea hens, and we just didn't have enough to make an impact.
well, we had a feral cat problem, and that's what killed all the guinea hens.
And that's been actually largely addressed, I think.
Right. So that's why I thought if we reintroduce them, maybe it would have an effect.
It's definitely a possibility. And I think there's not going to be a single solution. One thing that has to happen is deer populations need to come down, not purely for the tick issue, but because of ecological damage they're doing elsewhere, some public safety hazards, and then for the well-being of the deer too. The deer population is not particularly healthy. There's a profound founder's effect going on because they're all descended from, 8 deer. With some minor wash ashores afterwards. And that needs to be managed. Then there also need to be issues addressed to pests, rodents, rabbits are also carriers and reservoir for all these diseases, as well as hosts for the tick. And then there's probably some habitat adjustment that needs to do. It's a project of years rather than anything quick. And I do actually think that, adding additional tick predators to the island is a good thing to do. I think that'll help manage ticks in the interface between the woods and where humans are, which is where we're primarily concerned about the ticks being. But I think it's really a really complicated one.
Hi, Curtis Barnes. I recommend chickens. I have 6 chickens I have no ticks in my yard. So not only do you get great eggs, but you don't have ticks. So anyone who has an interest in the room, get chickens, and you do need a permit for that. Thank you.
It cannot hurt.
If we did guinea hens, I mean, who manages that? I mean, it's a town initiative, is that? I mean,
Well,
what department is
I mean,
that?
it could be done through, the town could purchase them, the Conservation Foundation, the Land and Water Council. I mean, you let them just go and
Yeah.
I was thinking more, not so much in the yards where you could have chickens and whatever, but in the moors and in Mattocket where people bike and walk and do all the stuff that they do. And they're a wild bird. They'll take just fine. It's just, a guinea hen and a pheasant will not leave the nest when they're on the eggs. And the cats just decimated the females. And once the females were gone, there were no more population.
I would be reaching out to, there's a couple of wildlife biologists who have been involved with this that I would reach out to see, because there have been a couple of kind of clever, there was an approach to either to sterilizing deer on the island or introducing a like permethrin treating on the deer directly to reduce their ability to be a vector.
To the feed station.
The feed station. But it turns out that the way that the numbers work out, that means that you would have to be doing that ongoing for 10 or you have to be constantly supporting that program for 10 or 15 years.
Yeah,
to the
I didn't think it as a solution, but I thought, it's almost death by 1,000 paper cuts. It can't hurt, and
Exactly.
you let a couple thousand guinea hens go on the island and they survive and they breed. And before you know it, if everyone eats, I mean, if they host more ticks than they eat, then that's not a good thing. But if you read these articles about a guinea hen eats 500 ticks a day, and you're like, well, why don't we let them go?
I mean, it's anecdotal, like that report of the host. Yeah, and it was a corpse, so like it's not representative necessarily. And then honestly, like I miss the guinea hens and the pheasants, so I wouldn't mind reintroducing them just for that purpose. So
Just a thought.
it's something, it's an all hands on deck kind of a response to this, especially looking at the alpha gal cases as being reported on Martha's Vineyard. We'd like to be ahead of that if at all possible.
Yeah, I like my red meat.
Yeah.
Okay, anything
Geese.
else? Okay, good, thank you. But
I'm sorry, I do have.
Okay, no, go.
I did not mention it before. The update would be. The update would be on the Vito Capizzo Field testing agreement, which we did get a meeting together with Land and Water Council, the school, and the health department. We have a agreement that is regarding the testing, the amount and reporting structures, and the thresholds of reporting and the various details. It is largely the same as the last one that was shared in June, with the removal of the adhesive, as there wasn't an effective way to do the testing that would meet kind of the standards necessary. We're also going to be meeting with Land and Water Council, ideally next week, to discuss potential monitoring approaches and other ways that we can track the impact of the artificial turf field on any impact on the aquifer and groundwater in the area.
Okay. Thank you. Andrew, Environmental Contamination Administrator update.
Yeah. Hi, everyone. Good evening. I'm Andrew Shapiro, Environmental Contamination Administrator. John, do you mind sharing my slides real quick, please? And I'll just give an introduction as to why I'm doing this presentation. So over the past year and a half or so, I've been doing an update on new PFAS data in private wells on the island. And our goal is that this raises awareness due to the fact that PFAS are commonly detected on the island in people's wells. We often have people who will take action and test their well once they hear about a new detection that's reported at the Board of Health meeting. So we see this as an important public health tool. And I am sharing this week the same kind of format that I typically do. I understand we have many new board members and maybe not everyone is briefed on all of the PFAS science and the activities that the health department is doing. So if the board is interested, I wanted to offer that I could do a more detailed update next month, or perhaps September after you have a full board. Let me know. So I'm going to dive into my typical update, and I'm happy to answer any questions, but the offer stands that I'm happy to do a more detailed overview in a month or two. So on slide 2, this is our update of new PFAS data that the town has received in the last month. So we have, this looks like 31 new samples in private wells. And these were all done either on a voluntary basis or as part of our Board of Health regulations, where private wells need to be sampled as part of the property transfer. So the most important result is that we had a detection above the state standard of 20 parts per trillion for 6 PFAS on Quidnet Road. And I reported this at the last Board of Health meeting. I was unable to get it onto the map for last Board of Health meeting. So, this is basically just keeping track of the detections and ensuring that our map is updated. So it's an important update, but it was in fact reported at the last Board of Health meeting. So that 20 parts per trillion, that's the state drinking water standard for PFAS, and the state regulates 6 different PFAS. We also got 9 detections below the state standard of 20 parts per trillion for the PFAS 6, and these can be concerning too. 2 of the most commonly detected PFAS are PFOA and PFOS, and the EPA has found that there's no safe level of those PFAS because they are likely to be carcinogenic. So those are important updates as well, and we had 9 such detects over the last month. The good news, we had 21 non-detects for the Massachusetts defined PFAS 6. That does not necessarily include unregulated PFAS, but it's generally good news when you get that result. And sometimes we also have updates for Mass DEP. Mass DEP does have an ongoing source identification analysis on the island, and it's been a few months since the state has been on the island, but sometimes in this update, we will provide the latest on Mass DEP's sampling as well. And then I reach out to everyone that gets one of these report backs, just to make sure that they know and understand how to read their lab reports. Sometimes they can be pretty complicated and difficult to work through. On the next slide, I have a map of all of the data that we have collected since sometime in 2024. And just to give you a brief overview of what's on this map, the green shapes are places where we have non-detect for the PFAS 6. The yellow is detections of the PFAS 6 below the state standard. And then the most concerning points are the orange and the red. So orange is detections between 20 and 90 for the PFAS 6. And that's samples that are above the state drinking water standard. Red is above 90 parts per trillion, which is Massachusetts's imminent hazard threshold. So that's the level at which even a short period of exposure to PFAS can be harmful to health. With PFAS, our main concern is chronic exposure because they're associated with things like heart disease and cancer that take a while to develop. So as you can see on this map, PFAS are detected in many places throughout the island, and our most recent data point is from Quidnet Road, and you'll see near Sasachica Pond that there is indeed an orange triangle over there indicating that latest sampling point. On the next slide, these are just our running statistics. So to date, we've had over 500 samples that have been reported to the Board of Health, either on a voluntary basis or because of our regulations. And Massachusetts, the state, has sampled at over 100 samples at over 100 properties. And I just keep track of these statistics. They're really informative for looking at long-term trends. So as you can see, the PFAS 6 are commonly detected in private wells on the island. 38% of wells have the Massachusetts PFAS 6. That is similar to numbers that you might see off island, but then we do have pretty concerning levels in some places, with 2% of properties sampled having an imminent hazard detection, and 10% at least having an exceedance of the state standard. So those can be concerning for residents who get those results. Lastly, I have a histogram. So this shows the statistical distribution of the results that we get. Again, I have it split out between the DEP results and the voluntary and Board of Health regulation results. And as you can see, for the most part, detections are below the state standard. This reflects what was shown in the table beforehand, but then we do have, in some cases, very high concentrations of PFAS detected in private wells on the island. So that's my short update. I'm happy to do a more in-depth update next time. And with that, I'm happy to take any questions.
Andrew, Carrie.
Hi, Carrie.
How you doing?
Good.
Last month, I thought you mentioned that there was a bunch of late results that didn't get onto you weren't able to get into the data set last month. Is that in this month's?
These are those results, plus a few more.
Okay. And is there anything with the seafoam?
No updates on the seafoam.
Okay. Thank you. That's it. Any questions for Andrew from anybody? Okay. Next agenda item is 13 Woodland Drive. And Dan, here.
Good afternoon, Dan Malloy for the applicant. I'll go through a quick rundown since some of the board wasn't here for part of the previous parts of the application. So previously, the board has issued multiple variances for this application related to bedroom credits. The previous meeting, the board approved the last variance, and as part of that variance approval, added a few conditions stipulating that we come back if the plan for layout should change, essentially coming back for layout changes or for any change to notify the board before we proceed forward with anything. So we're here first off to satisfy that requirement. So the project is likely to change. On the previous plan, the elder was an elder housing complex and was located on the right side of that plan. Right now we're looking like we're switching sides. Everything might push to the left. So we just wanted to show that to the board because that was a request that was made as a previous variance. And further from that, just to clarify some of the conditions that were put in the variance request as to whether or not I would ask that some of them be lifted, whether or not those are really relevant any longer. So what we'd like to do is ask that if we make any additional changes to this, as long as the changes do not impact any of the bedroom credit or variance relief, which they will not, aside from something of a variance level request, that we don't have to come back and present this to the board again. So if a septic design were to change or if a building were to move, that would get handled like every other application in front of the health staff. The department staff would review the application and either approve it or not. But anything related to the actual variance in terms of bedroom credits would still have to come back to the board itself. So we'll ask the board to consider lifting that requirement because that's not something that, in my experience, you've required in other applications that we continually come back for further review. Other than that, it's just changing some of the wording, or again, if the project should change, the variances that were issued were to do with the amount of bedrooms on the property or the septic flow, whether it's a house, a condo, elder housing, whatever the flow is, whatever the type is. If it's a residential flow, that's what the variance granted. So the specific residential use isn't necessarily applicable. So we're asking is that some of these conditions be lifted. The variances themselves stay intact as originally granted. Anything beyond simple Title V level changes, anything in those regards handled by the staff, anything beyond that comes back to the board. We have looked at the staff recommendations. We're fine with that. The inspections, all that stuff should still take place. And the walkthroughs using the IA technology, that's all stuff that we agree with. We agreed then, we agree now. That's part of the variance. That's essentially it. So it's a cleanup exercise, nothing more.
John, do you have anything to add to this, please?
I'll just kind of reiterate Dan's speech or presentation. Yeah, so everything's just moving over to the left there onto those 4 lots, and then those 2 bigger lots, everything, those would be deed restricted. They would be conservation restrictions. I think that's the requirement. As part of nitrogen aggregate plan. So that would need to be established for those for the whole thing, because those 4 lots, each one is 20,000 square feet, I believe. So obviously you can't have, I don't know, what is it, 8 or 9 bedrooms on each of those lots?
Right. So big picture, if this a plan like this were to proceed, a separate application would come to the office, a nitrogen aggregation plan, which would be typically handled by the office staff. That plan wouldn't normally come before the board. And what that plan does is say that the property under its current state and permits can handle X number of bedrooms. Those bedrooms are going to be put in one place or another, and some other portion of the property will be restricted to compensate for where those bedrooms are placed. So it doesn't change it doesn't change septic capacities, it doesn't change permit allowances, it just changes where things are going.
Hey, I'm looking at this. So first we got that landlocked thing. Have those properties been joined yet?
No, they have not.
Okay, so they haven't done that. And now we're crowding all the houses at this end, creating a huge open space that looks like I could see another attempt to put more houses in, which was the original thing. So there's a trust problem here with this particular group. We started off with 2 houses, one with a 12-bedroom and then a 7-bedroom. I thought we got agreement that, that would work out, and that the plan that we kind of said you guys are going to do is what you guys put in the paper before you came to the meeting. We didn't start elder housing. The developer did. And I'm not taking you, Dan.
I understand.
That so I just, because of the lack of potential trust, I have a big problem with, they haven't joined the lots yet, and they've kind of let this giant open space, and it seems like all the septic stuff is crammed into one end. I know that there's area, but it's all there in that area. So I'm really kind of, I thought we had it worked out, honestly.
So-
And, I'm going to make a suggestion. We have new board members. And if you did follow meetings before, this has been going on now like for 8 months. So, and we have also a new board member that will be coming on next month. That rather than acting on this now, give everyone a chance to catch up on kind of the history of it. Because again, I'm not really, I'm just a voice, but this does not look like what we've talked about. That proposed that, to maybe make a motion for a continuance so that we can talk about this with the full board. Maybe give the developer a chance to explain why they haven't joined the lots yet. Because again, that was all stuff that we thought was worked out and really didn't seem to be controversial. So, that's my opinion, and I definitely open up for anybody else. And Aaron, you have more experience in, septic stuff.
If I can just add real quick to that, one of the reasons we're here as part of the request is partly for what you're saying. And I understand what you're saying and why you're saying it. But the topic that you're getting into in terms of combining lots and where things are
It's not ours.
is, well, it's beyond it's beyond the variance request itself, and it's
Mhm.
beyond the relief and the regulations that we're looking at. That's the problem. We're talking about, we're getting into zoning and property line mergers, which are beyond the regulations that we're here to talk about with the septic system.
So we were
Two
talking
different
about
things.
square footage of the 2 properties together as being the source for determining the capacity. Am I correct?
the square footage is there, but where the property lines are irrelevant to the septic system flow we're talking. They're two different things. I understand what you're saying,
Yeah.
but what the regulations for this specifically discuss are the septic system capacities and where they're going, the property line and the areas in those terms, what you're talking about don't apply. They apply to the project, but they don't apply to the specific variance in the way the variance bedroom credits are granted.
Again, so, but okay, and I'm using different states kind of perspective, but if that even though this is owned by both individual lots are owned by one person, you're calculating the septic capacity
So
you're
the septic
calculating
capacity is based on the
and
entire area
using
of the
both,
property.
but I'm not sure if I'm allowed to put septic systems on somebody else's property, even if I own it.
So
It's like granting it, and the reason it's like granting an easement to yourself. In some states, that's extremely difficult to do because you are the owner, and it's that kind of, if you own the property, but it's not part of the whole thing, is that
So
kosher?
the way it would work in that case, the answer is yes, that can happen. So that's what John was talking about, the nitrogen aggregation plan. So when a property can support a certain number of bedrooms, if this property line's dissecting different pieces, but the overall piece has been designated a certain amount, you can file an aggregation plan with the health department, which says we're going to, instead of spreading them out, we're going to put them over here, and then we're going to restrict over there. And what that does, it basically essentially says the number of bedrooms cannot change. We're stating they're going over here in this denser area, and we're going to have to restrict this other area so nothing can go there.
Yeah.
So there can't be additional septics or additional bedrooms somewhere else. You're still fixed to that same number. It's just a question of where it's put.
And terminals. So I guess is there, and again, this is Ernie and John, this is, is the concentration of the leaching systems in that 4-strip area of a concern, given it's 12, I think it's 12 structures. Is that a concern that, and again, those are adjacent to somebody's property that's not part of the developer? Am I correct?
It seems like it's a math equation to me. I don't see, I think there's a area, I think the area is applied to Title V, and the area develops, he gets a bedroom credit based on those math problems. I think zoning and the planning board really get to decide what this thing looks like and how it gets diced up. I think the Board of Health, my opinion is, I don't think it's for us to decide how this thing gets diced up. I think
I'm concerned about the septic
yeah.
fields, the concentrations in that area, and again, adjacent to a neighboring property. And that's all there as opposed to using all the land you have available.
Yeah, if there's wells around, I think there's
It should be town
setbacks to the wells. I think there's setbacks to the houses. I think.
So again, this plan doesn't show that stuff, correct?
So everybody around us is on town water. There are a few wells further away, but we're more than adequate distance away from any well protection zones.
Will this property be on town water?
Yes.
So right now, I guess I need some clarification. Because I'm coming into this after the fact. So you had to come in front of this board before because you wanted to exceed what you were allowed under the regulations, under the zoning regulations.
So we came to the board asking for bedroom credits utilizing IA septic systems.
Okay.
That's what was,
And
that's
that-
the variance that was
And
granted,
that
nothing.
based on when you use an AI system, it decreases the amount of square footage of land you need, so you get more bedrooms. Am I correct with that?
Essentially, the IA system is a better quality product. So you
Right.
get
So you,
credits.
so you don't need
extra
as
bed-
much land.
Correct.
no different than if somebody had a lot that was for 3 bedrooms and they wanted to put in one of those, what are these little units we calling now, the cottages?
The ADU.
ADU, they'd have to go and put an AI system and they come in front of this board and request it. So with the AI system, you're allowed 19 bedrooms or 20 bedrooms? How many are you
So with
allowed?
the AI
With the amount of square footage you
With
have?
the square footage we have in total right now, we have approval for 31 bedrooms across the entire property.
Okay,
That's what our approval state as of right now.
okay. So,
And there's no change to that.
so why is there a restriction in here for 19 bedrooms?
So the variances were granted on individual parcels. The last variance that the board granted had to do with 2 parcels to the right of that
two
plan.
big
The
parcels.
2 big parcels. And for those 2 specific parcels, their square footages combined allowed 19 bedrooms. That's where
So
the-
with those 12 units you have on there now, are you going to try to put 31 bedrooms in those 12 units?
I don't expect we are now. We're probably going to use less. There'll probably be an excess capacity. Realistically, you're looking at, and I'm guessing, I don't know what's going to happen there, but 31 bedrooms out of those 12 units is extremely unlikely.
And can you move property lines around on this, or are these set in stone?
Oh, property lines can move things.
So you can get 31 bedrooms in there whatever way you want.
Correct.
So why are we even discussing this, I guess, then?
So we're here because the last approval from the board requested specifically that we come back to you and show you a change to the plan. So that's what you see in front of you. So one of the reasons I'm here is to say, I want to satisfy the conditions of the variance, saying we'd come back and show you, which we're doing, but also then request that if it changes again, and it probably will, because we still have to go back to the planning board, that we don't have to continually come back. Because every time we go to the board,
So you're asking for, once you get a final plan approved from the planning board, you're going to go to staff
we have
And-
to go to staff regardless.
and
but-
they're going to approve it based on what the regulations are. You're not trying to exceed those regulations.
Correct. So it's no different than filing an application for anything else. It would go to the staff. This board is not issuing me a septic permit today. You're just agreeing with the variance, what's there, and alter its conditions. The staff still has to review a septic application like they would for any other property.
I have a hand up if you want to. Okay, Art.
Thank you, Arthur Gasparo. I just had a question, whether Mr. Malloy made a comment that perhaps, and I think by the way the dwellings are laid out, that these 4 lots that development would happen on, the units may not all be held in common ownership. And I think that's a concern that the board should consider as part of granting this variance. If those were 4 lots being developed to be held in individual common ownership served by a single separate septic facility, then that would be one thing. But if the intent is that the dwelling units on each property are all, so you're basically going to try to have 12 different ownerships and then 3 dwellings per lot sharing a single system with different owners, I think that raises additional questions and concerns that the board should understand, specifically with respect to Title V, 15290 for shared systems. I think it's very different to have, in grant relief, if in fact that was a septic system serving, a single lot under one ownership. If this is 12 different owners and they're all sharing the system, perhaps this should be continued to understand that. And then with respect to the aggregation plan, I think that Mr. Strang is right in terms of it's a math problem, and if they meet that. But that aggregation plan would also have to be approved by Mass DEP, and I wonder if, in fact, that shouldn't be in place as either a condition of this or prior to this. So just a couple of questions to be considered. Thank you.
John.
Yeah. Oh, sorry.
Well, no.
Hi.
Go ahead.
Willa Arsenal speaking on behalf of Nantucket Land and Water Council. Certainly, I appreciate Mr. Malloy's information that he's given so far. We had a couple concerns when we first saw this application come in. These conditions were attached to the approval imposed by the board just this year, and they were thoughtful, substantive conditions, not anything that I saw as simply an administrative detail. And I think I understand a little bit more now, thanks to Mr. Malloy's explanations, but I'm still not understanding. I'm not seeing an explanation for why they need to be removed now, or justification is maybe the more appropriate word. I would personally appreciate a little bit more clarification about what the practical effect of removing these conditions would exactly be. It sounds, I understand that the project is already limited by the allowable aggregate nitrogen loading under the approved variances, but it sounds like you're asking for additional flexibility to allow for up to 31 bedrooms. Perhaps it's unlikely that you'll use all those 31 bedrooms in these 12 dwellings, but it sounds like it will be a more intensive project than what was originally approved in February. Without the context of a more detailed narrative and site plan, it's difficult for the public, or for me, even personally, to understand what, if anything, these changes would mean in practice. I want to be clear, I'm not necessarily opposed to this, but I just think if the board is being asked to remove conditions that were part of an original approval, it would be helpful to have a clearer explanation of why those conditions are no longer necessary, and what it would look like if these conditions are removed, if that makes sense. Thank you.
Thank you. Yeah, I'm looking at your note, and I guess I'm confused where 31 bedrooms comes in, because it says here that the condition establishing a maximum of 19 bedrooms and 12 dwelling units. Is it 19 plus 12 is 31, but bedrooms are different than dwelling units?
Right. So there's a couple of things we're looking at. So there were previous variances granted on 4 lots.
Mhm.
We're not actually here about those. The last variance the board granted was actually only in relation to the back lot in the back. So when the board granted the last variance, you looked at them as a combined 2 lots. One of the lots already had a variance for 12. So the lot in the back was effectively the variance that was granted for 7 bedrooms. So you have the 12 plus the 7 is 19.
Right, and that
And
was the
board
original
had
discussion.
the board had already granted variances to the left for 12. So the entire property, 12 and 19, is 31 bedrooms. So that's where the aggregation comes from. So the variances were issued, the bedroom allowance is there. What we're talking about now is not adjusting the bedroom count. We're asking to not have to come back when these things tweak again. Whether some of the comments, whether it's a shared system, if it turns out to be a shared system with multiple owners, that's part of the septic application that has to go to staff. That's not something that gets hidden. That has to happen. So if there's multiple owners and it's a shared system, that's a staff approval like any other application. That's not something that comes before the board. That's a staff approval. So what we're looking at here is every time we adjust something, we have to come back. And that's not normally how the board operates. It's not a routine filing that the board has historically done. So every time we go to a board, we can only go so far until we come back and make sure you're okay with it, which typically isn't the case.
Are shared systems allowed?
Yeah, shared systems are allowed. Yep.
Okay,
I mean,
so with new
there's
construction.
there's several different scenarios and several different developments on the island that have different things kind of similar to this, like Hydrangea Lane out in Sconset, Ellen's Way out in Myacomet that was I think a community aggregate plan, which probably did require DEP approval on that one. But shared systems are allowed.
Okay,
They do require a few different things. One specifically and importantly is a financial mechanism for assurance of basically who's responsible for replacing what if something fails on the system. So they do have to have several things in place.
John, can I ask you a question? So there's 4 lots there, 31 bedrooms, basically it's 8 bedrooms a lot.
Right, basically, yep.
Yeah, so if the proposed areas there where the systems would go in, is there enough room and setback from the properties behind them to adequately do that, or is it?
Yeah, I believe everything to the north of there is on town sewer. So that.
And town water?
And town water, yeah. So that's more important actually. So that eliminates the setbacks right there. So, or at least a lot of them anyways.
So the only thing, even though the only thing that's not here is, and I get your concern, is right now you're saying you're gonna put a conservation restriction on those 2 big lots to allow you to put everything on this end. But until that's in writing, it's only as good as a word. And I
Right.
mean, there's no stipulation from what I've read in here that states that you can't build on those lots or come back later and say, hey, you know, we want to put more dwellings here.
There would have to be, if they, I guess I'd call this kind of a concept plan. So those 2 adjacent lots on the right, the east there, those would have to have restrictions. And there's all sorts of, actually nitrogen loading restrictions as far as, believe it's like no fertilizer, no livestock, even, things that contribute to nitrogen loading.
Well, if right now they've got 12 units on those 4 lots, if they decided that they wanted to move and only do 2 on each of those 4 lots and put the rest over on these other 2 lots, as long as they don't exceed the 31 bedrooms and the septic systems all meet, because they can move property lines wherever they want, basically, is my understanding.
Right.
They have adequate access from public ways. All that goes through staff. We're not giving them any variances, correct?
Right. So the applicant received a variance to the Wellhead Protection District regulation prior to its amendment, which is now effective July 1st. So the board did grant them variances for those 4 lots on the left there are 20,000 square foot lots, and the board allowed for 3 bedrooms on each of those with an IA system. And then that big lot in the middle there, that might have been 19?
That was 12.
12?
12 with a big one and 7
okay.
in the back.
12 and then 7 with that top lot. So what's that, 19 altogether for those 2 lots. And now when you combined that, all those properties, it's 31 bedrooms. So
So
I'm
all they're trying to do is to stuff 31 bedrooms into a smaller area.
basically you could say that, yeah. So it looks a little,
But the system
exactly
can
like it
handle
is.
that. If they were to put a system on the end of each one of those lots, even though they're 20,000 square feet, there's
Yeah.
adequate space to do that.
Yeah, I mean, they need to be designed that way. I mean, they have to comply with Title V and local regulations. So that can happen. I guess sometimes you look at these and you see lines on a plan, but the reality is it's a facility and it's physical land, and it's really just the nitrogen loading of that combined area there. So it would require the nitrogen loading plan though, to be
And
viable.
that would go through staff and have to be,
Yeah, it might even need DEP. There's certain ones that do and certain that don't. So, but I mean, I can definitely be in contact with them just to walk through it, just to be sure.
Would we be better served if we actually had real plans again? This has been a problem all along with this particular project, in that we get drawings or sketches and
I mean,
I know that, again, the town did vote down overloading a lot at a town meeting of 2025, I think it was.
Yeah.
So, there is a concern about overloading. Our discussions over the many months has been about, we want to see the plans, and we've gotten like a pool here, and that was earlier. That was the early stuff, when it would be big houses. And And, I think I can safely, given the turnout we had at the beginning, concern from neighbors that, that, again, density is a concern. So we know that there's certain things that are allowed. And I think our thing is, we want to know what it is you're putting in there. That's pretty much, we
But-
worked out. a
But is
deal.
that our responsibility? I mean, he's got to go to the planning board to get buildings approved. We're not the planning board. We approve how many bedrooms he can put in. Under the regs, he can put 31 bedrooms in on that whole big piece. They're gonna go to the planning board.
Oh.
The planning board's gonna tell them how to move the buildings or approve where buildings can go and all of that. I don't feel like I need to see a planning board plan as long as he's not asking for more than what he's allowed. The math's the math. So,
Sorry, it's the 31 across all those 4 lots and the 2 side lots there.
the whole
Right.
piece,
The
right?
The 6
So-
lots is 31.
But the planning board's going to tell him, they can look at this and say, that's too dense. So you're going to have to put 2 on each one of those lots and move some over here. It's still only 31 bedrooms. He's not coming here and saying, I want another 10 bedrooms.
But so if in the past, one of the concerns was that the lots had not been joined, and I might be misunderstanding this particular point, but the 31 approval for all of them, if you then have 31 on those 4 lots and those lots are not approved at a later date, they could be like, you could then either sell or move on one of the other lots unless they're in there's the deed restriction for conservation.
Right, so lot lines can always be moved. The 31 isn't going to change. That can't be increased. It doesn't matter what we move. If we sell, restrict. We can't do anything without a permit from the Board of Health. So anything any design we do goes through John. He has to review it, issue a permit, make sure it's compliant. We can't then move a property line and sell something to somebody else they can build, because that whatever we're building using that credits for the bedrooms is restricted. So nobody can sneak in and add or buy or transfer. The limit has been set. It's 31. And
For that whole
nothing,
big piece.
the whole big piece,
All the 6.
and nothing can happen beyond that. No additions can happen, period, because that's the limit of the variance. And design changes, all the regulation compliance has to go through John's office, through the actual board, the health department, before we can actually do anything. So typically what the board does, the board issues variances on the big picture of what the request is, and the actual detail of the application, design, and the permit is handled in the health department. That's generally how the process works.
Is elder housing still on the plan? I mean, I'm just looking by what you said. It's like,
It's not on the plan, but that's still part of our development plan, is to still pursue the elder housing. But what I'm getting at is, whether it's an elder housing or if ends up being a single family house, whatever it ends up being, it's still limited to 31 bedrooms. Whether it's the type of use at this point is almost irrelevant. It's the 31 bedrooms that matter. The use itself isn't something the board is governing. It's the number of bedrooms and the septic capacity or the flow attached to it.
so the original plan of the 12-bedroom and 7-bedroom houses still could come back.
It could.
As long as it doesn't exceed 31 bedrooms.
Right.
Right.
I don't understand why there's a restriction in here through the Board of Health for elderly housing.
They're the
Who
ones
put that
proposed
in?
it.
Did you guys want the
That was
restriction in
the
there though?
paper. I mean, they went to the paper, we're doing elder housing, and we
So-
said, that's a great idea, so we supported it. I
We
mean,
were in front of the
we didn't-
board
We didn't put that on there.
with elder housing.
Well, you're asking to get that removed now.
I'm asking it removed, yes, because it's not something, we agreed to it. The board issued it. We wanted to close the process and we were able to close it. But some of the conditions that were put on it relative to an elder housing use, relative to coming back for further review, are not something, in our opinion, should have been conditions where they don't impact the variance that was issued. Whether it's elder housing, one house, whatever again, the number of bedrooms is fixed. So the use of the property at that point isn't something that's really in front of this board. It's the number of bedrooms. That's what we've been trying to get at. The entire process was in that direction. This is the conditions of what we ended up with, and that's why we're here.
The conditions they agreed to. I mean, that's part of the problem, is like, we had discussions, we went through 8 meetings, came to that, now you're saying, doesn't really matter. We can put in whatever we want, and I think that that is part of the problem, and that there is a level of trust that, and, it started, the original plan was 12 bedrooms there, 7 bedrooms there, swimming pool, essentially a short-term rental type house. It wasn't a family, it wasn't a good Catholic family moving in there. That was a big, a party house. And, but a lot of bit discussion back and forth, feedback from neighborhood and everything. You folks went to the paper about the elder housing. We didn't bring that up. And we said, yeah, that's a good thing, that it meets a need. And so part of the problem is, yes, 31 bedrooms. I guess technically you could put a skyscraper there that has 31 bedrooms, as long as it's not 30 feet tall. But it seems to hit the issue that there's a other plan that's running in the background the whole time, and you had no intention of doing this at all. And, we gave variances based upon what we had in front of us, and what we have in front of us is always changing. And that is somewhat frustrating to deal with. Yes, I know that we have a limited purview in terms of what, but there was an agreement based upon months of back and forth. And again, a lot of stuff that we had nothing to do with, we didn't put the elder housing thing in there. That was put in the papers, big deal. So, I mean, that's kind of where I am, is that it's a total lack of trust. But given I'm one person, there will be a new member next month, that possibly what we should maybe do, if the rest of the board is up for it, you can do a continuance, that you folks, new board members can, go back and look at all the minutes and look at all the discussions. And that way, the full board, we'll have a full board next month, and it can be frozen. If there is a more developed or more real plan, I mean, that can kind of, with more detail or something, because there is, Arthur brought up about the Mass DEP and those kind of systems there. There are issues that would have to be addressed. So if we had more and a full board, I would be more comfortable with whatever the outcome is. I know we can do something now and
I have a few hands up if
Mhm.
Art.
Am I still unmuted?
We can hear you.
You're good.
Okay, thank you. So I think what might be being somewhat missed here is the 31 bedrooms are not by right. You're in the wellhead protection zone. So it's with the variance. That's what the variance here is really for. And I think that I don't have the total, I can't read the plan, the total lot area of all of this in aggregate, but your by right would be the number without that bonus. And so if Mr. Malloy is saying they're not actually may not actually build the full 31, perhaps there's some lesser number that's a condition of the variance approval that you could consider. Again, perhaps a limitation on the division of facilities per Title V. You're granting a variance within the wellhead protection zone to allow the additional loading. The 31 bedrooms are not just by right. So I was hoping that might be clarified. Thank you.
And I have another. Okay, Donna.
Hi, good evening. Thank you very much. Donna Marie Quinn, 71 Skyline Drive. I just was informed about this afternoon. I know that, well, I speak for myself right now, but we as neighbors have come to a decision a long time ago. We liked the fact about the elder housing. I wonder what has happened to that. That's number one. Number two, what about the water quality? I guess it'll be on town water at this point. And number three, has it been tested? I myself had to abandon my well. I want to know why now there's a change from elder housing to go to this. Was it not profitable enough? Again, we had many meetings. And is this on 2-acre zoning? Um, I think it's on 2-acre zoning. And I also want to know about where the traffic will dump out on. Will it dump out onto Skyline Drive and then Webster Road? Thank you.
Question. Without the variance, how many extra bedrooms does he get? Or less does he get? He has 31 with the variance.
Right.
What was the credit? How many did he get credited?
Let's see, 2, 4, 6, 8. 16. I think 20. Is that about right?
Yeah, around.
So there's like 11 extras.
Yeah, I believe so. Yeah, sorry, I can't read. I think this is a 2-acre lot, so that was 12.
It's approximately
Mhm.
20. Yes, that's
Yeah.
correct.
2021, something like that.
Yeah, it's about 20.
I'm not sure. Maybe you could answer this. Do you think the overall 12, if you give the spare bedrooms and it's an IA system, do you think that the nitrogen loading, or know that the nitrogen loading is less versus a conventional system using the 20 bedrooms?
So in theory, yes, an IA would reduce nitrogen technically in half by a conventional system.
Okay.
So even though we given him 31 bedrooms, it's still less nitrogen than 20 bedrooms, which it is by right without the IA systems.
Correct, on a conventional system. But as effective now, an IA system's required in the wellhead protection zone. So all these properties would still require an IA, whether there's 31 or 20, based on the amended regulation.
If I could just add one very
Yeah.
10-second thing. So just to be clear, we're not here asking to change bedroom counts, change the variance allowance in any way, shape, or form. All we're asking to do is adjust the conditions in the last variance that was issued. That's really all we're looking for. So we don't have to keep coming before you. Development plans change all the time. Is this the plan? I'm hoping this is the plan. Is it going to change tomorrow? Yeah, yes, it could. It could change again. But how it changes is locked in by this board relative to bedroom capacity. And that's typically how it's always handled. Where a building moves tends to be immaterial to the variance itself as long as the variance is maintained. And so really, again, it's just a couple of conditions in the permit we're looking to change. That's really all this is.
I think I have Donna's hand up again.
Yes, I'm here. Hi. I think this should be continued again. I'm sorry. I don't mean to sound awful, but I approve the elder housing. I think it's something we need here in Nantucket.
So with respect to continuance, if we have any say, we would like the board to vote. We're trying to move forward with the project. We're not looking to come back and delay another month for this. We would like the board to vote on whether or not you're interested in adjusting these conditions or not. Otherwise, we have to wait another month to come back and continue. We can't move forward if we have to continually come back to present a change.
Willa?
Hi, Willa Arsenal again, speaking for the Nantucket Land and Water Council. I'll keep it brief. I would echo Mr. Gasparo's comments about this originally being a variance. It's part of the Board of Health regulations that variances are considered the board has a right to consider them on a case-by-case basis. It sounds like there's confusion that we're hearing about what's happening to the bedrooms here. Is it 19? Is it 31? Is it somewhere in the middle? There are neighbors commenting, asking for more information or for a continuance. Again, the Land and Water Council would be interested in more information about what the practical effects of this might be. I see there's 12 dwellings on the left now. It's hard for me to see what the bedroom counts could be. It sounds like Mr. Malloy is saying that could change in time, and that there's I understand that's how planning goes. I think it would behoove the board to use their discretion to consider this carefully, as there are, of course, concerns about nitrogen, but other things can affect environmental concerns and social concerns like traffic that do fall under the Board of
But
Health.
that's not us.
Okay, so there are other environmental concerns that do fall under the Board of Health's purview that I do think that would be worthwhile to consider with more information. And again, I'm not opposing this project. I just feel like there's confusion going on in between what's happening now and what will happen in the future.
I mean, and again, this is not in this particular project, but it has been our policy since I've been on the board to, when we grant variances, is based upon having a plan and seeing the full impact. And that's been the problem we really have had kind of because we started with the big houses, that was smaller houses, and yes, we're only the Board of Health. Our big thing is the the septic and all that. But the other thing is we usually work off of a plan that is a plan. And that I don't think is an onerous thing to ask. We've done that for almost every, in fact, we have not rejected, but we have gone back saying, come back with a plan to others because, it's too fluffy. I mean, it looks like it might work, but you don't have enough detail here so we can kind of see all the impact. All we're asking for really is a clear plan. And we can't argue at 31 bedrooms. We've granted that already. I mean, that is a go.
That was granted for an elder housing project.
Well, we thought
But again-
we thought that was going to be, but again, we're not the zoning board or planning board, but we usually grant variances when there's a plan. And
Just
that's
to
why
try to clear up some of the confusion that Will has said is there, or maybe not there. So 31 bedroom is maximum. That can never change, right? So in terms of confusion of additional bedrooms, that's not something that will happen. Just clarifying.
That's correct.
Okay. So that confusion is clear. And then in terms of age restriction on any type of building, I don't feel that's our purview. I love the idea of a 55 plus, but if we're focusing on increasing wastewater and nitrogen loading, it's the assumption that a 55 plus would have, less wastewater and less nitrogen. So I think we have to be really tricky. That I feel strongly that's not our purview as the Board of Health to decide what age group gets to use the buildings that are there. Or we would need data. I would want to see data and, evidence-based science that shows that demographic and that age group has less. And I think that's really tricky when you weigh in family visiting, aides that would come. Is there more water usage? So I think that gets into also a purview that's not ours. So I would question, like, how was that decision made initially to make it 55 plus only? And again, as a citizen of this island, I love that idea for 55 plus. I just don't think that's up to this board to decide.
So so on that topic, the last variance that was requested, we were before the board with a plan that contemplated an elder housing development. That's where that came from. It's still the same number of bedrooms, the same septic flow. It didn't change the aspect of the variance in any way, shape, or form. It was just that use that was proposed under that variance was elder housing. But the septic system flow, the treatment, everything about the variance, specific variance relief in the regulations is still the same.
So it sounds like to me, the mechanisms to protect increased nitrogen loading, more wastewater are still there. Is that safe to say?
Yes, correct. Yep.
Okay.
It'd still be the same system, which the board at that time when they granted the variance is something called best available nitrogen reducing
Right.
technology. Right now, there's none that have general use certification. They're all in kind of a piloting or provisional stage. So if those were to become general use, I would recommend those be installed. But yeah, the loading as far as 31 bedrooms that's not going to change.
And that was something already voted on.
In reality, kind of a seasonal is going to be less nitrogen loading than a year round.
Right.
That's just based on use. IAs do take a little bit to kind of get going in the summertime, you know, initially. There's kind of ways to jumpstart them a little bit, but I mean, they can take a month, even maybe 2 months to kind of get going, but they're still operating the same as a conventional system in that manner. So.
And just to clarify, so any future reconfiguration is really what we're talking about, not any changes to bedroom numbers. Again, I will clarify, just to understand. I mean, I have looked at these plans. I did sit with them this week when we got the agenda. So I don't know that passing the buck another month, if we have all the answers we have now, I'm just trying to understand how that makes sense to just keep passing it on. If our concern for wastewater and nitrogen loading, if staff is saying that those mechanisms are safeguarded, unless someone
Well,
misunderstands
again,
something.
I think our thing, my thing is that we generally granted variances with a plan. This is like the fourth or fifth plan we've had.
But,
it would-
so what changed? Just the reconfiguration of it changed, is that right?
All right, well, yeah, from the last one, yes, there was a whole different, using the lots differently, the last one. And, you know, again, different layout and stuff, so.
But
But-
again, so then how is that our purview? I'm
Oh,
merely
no,
trying
to
to
a
learn.
point, I agree, but I guess my concern is, are we going to start approving variances without plans?
Yeah.
So
We're going to
that-
base it on what as far as I'm concerned, I'm going to base my decisions on what is allowed on that lot. And that's what my job as a Board of Health member is. I'm not here to decide where the lot lines are or what structures are put there. That's the planning board. The HCC decides the buildings. I don't worry about traffic. That's not my job either. I'm here to regulate Board of Health regulations, and the Board of Health, your board or the past board already voted for 31 bedrooms. As far as I'm concerned, all he's asking for is he doesn't want to have to come back here every month because they move a lot line or they move a building. The math is the math. It's been approved by this board. There's no additional request. I'm ready to move on. I'm ready to make a motion that we give him the ability to not have to come to this board every month. And he can go through the planning board stage and staff can approve the septic systems to make sure that they're all within the setbacks and the requirements under the law. And that's my motion.
Do we have a second?
Second,
Second, so, making,
And then we
make-
can
make a
discuss.
formal- Make the formal motion.
I'll make a formal motion
Yeah.
that we grant.
What are we granting, not relief, are we granting relief from what? He has the variance.
The requirement to come to the board every time the plan changes, to the Board of
So
Health.
we are acknowledging there is no plan.
Yes, we're acknowledging that,
Okay.
that the
Just-
past board approved 31 bedrooms for this piece of land based on, I don't know what you were looking at then, but you
We
said,
use the
you
total square
said
footage.
total
and
square
that
footage,
was-
exactly. So
Yeah.
the math allows for that, and that was given by the past board. And that the planning board and the HDC and all the other departments in this town that have to decide how this is going to be divvied up on that big chunk of land will do their job, and our job is to make sure that they don't go over the 31 bedrooms and all the requirements are met. That's my motion. I don't know if that makes sense or not, but
So just for,
Yeah, we want to.
just for clarity.
Yeah.
The motion would be to relieve, so
to grant relief from having to come to the board every time the plan changes.
So there's a couple of conditions in that. Was
Yeah,
that the only
So-
condition you?
yeah,
wanted
the
relief
three
from?
conditions I think are
There-
what need
There are 5
to be included
conditions
in
in the
that.
variance. We're asking for relief for 3 of them. The first one being the coming back to the board. The second one being the restriction on the type of use, whether it's elder housing or a residence. And the third, well, actually, those two go together essentially. It's effectively everything we've talked about is the 2 conditions, let me put it this way, the 2 conditions that would remain to make it clearer would be staff walking through buildings prior to issuing COs to confirm that bedroom counts are indeed in compliance with the 31 maximum, which we recommended that and we agreed to that in all of the meetings. And that all of the systems utilize the best available IA technology. So those two conditions would remain.
to banner and walk through. But the,
4 and 5.
One, two,
so
and three. So site plan revision, bedroom and dwelling unit. I'm sorry, got closer. Site plan revisions, which was Article 1, bedroom and dwelling unit limitation, which was 2, and restriction to elder housing was 3. So,
May I ask a question through you, Chair?
Yep.
Dan, in number 2, I've asked this pretty much twice already in my own language, but dwelling units be modified to provide flexibility. If the amount of bedrooms, number of bedrooms cannot be increased, what does that verbiage mean to you? Dwelling units be modified to provide flexibility.
So the previous variance had a dwelling unit number limitation attached to it. So we're asking that that be removed. So if there are 12 units and the 31 bedrooms are in those 12, or there's 31 one-bedroom units, again, the number of units is not relevant, it's the bedroom count.
Got
So,
it. So it's just that count again, not going up.
correct.
Thank you.
the motion would be to relieve Articles 1, 2, and 3 from the previous variance request.
But the zoning has requirements as to how many buildings, correct?
The zoning has.
The planning
depending on
board
the-
would be the one that would decide that.
That is correct.
and again, and just for clarification, the number came from the previous plan that was presented. I mean, that wasn't, again, it wasn't an arbitrary number.
I don't,
Right.
I get that.
Yeah.
I'm just,
Yeah.
and this is the problem with this, is every time the plan changes from 10 dwellings or 12 dwellings to 9 dwellings, and here we are again. So this is what I'm trying to avoid, is 31 bedrooms is what is allowed. I would grant him relief from 1, 2, and 3, keep 4 and 5, and then this process can move on, and staff, I have full faith, will make sure that it's done properly.
I agree.
Yeah,
So that was my motion.
okay. So that's
The
okay.
motion is on the board, needs a second.
Second.
Okay, we will, well, even do, we don't, actually, I'm gonna do roll call. Just, I think that'd be better.
Mhm.
Ernie?
I
Kate?
Aye.
Aye.
Carrie, no.
Right.
So,
Thank you.
3-1.
Thank you.
And next we have 49 Pulpus Road, the appeal of order to connect to town sewer, and this is continued we skipped a month. From last October, but we did a continuance in the May meeting. And that was when Arthur came on board and
Yeah.
he asked that we hold off till July for the meeting. So,
I'm sorry. Yeah, we postponed it.
Yeah.
From the May meeting until this meeting. As you said, this matter has been before the board since last October, and Carrie, of course, is the only member of the board who has seen any of this before. My client, Inez Hutton, who is here with me tonight, is the owner of the property in question on Pulpus Road. And the issue is that there's been an order issued that she connect to the town sewer, as is normally the case, where town sewer becomes available in the public way adjacent to the property. The reason why she hasn't connected is simply the expense that would be involved. Ms. Hutton is an octogenarian, as am I. And as such, she wants to be able to remain in the property for the rest of her life, as long as she's able to. She's been living off a family trust, which is now virtually exhausted. I had a conversation this afternoon with the trust officer who handles it, who describes her financial situation as dire. She has a mortgage on the property, which she is struggling to pay on an ongoing basis. And the trust officer said that there's basically no way that the trust can advance any more money to her, or that they feel she'd be able to maintain any additional liability in connection with the connection of the sewer, even if some form of funding were made available to her. The property is, the expense of connection is going to be high. We have an estimate from Toscana for 125,000 for a 550-foot line to be run in, with lots of exceptions on there as to additional expenses that can be incurred, in addition to the Nantucket factor that always sets in addition to the fact that there are utility lines within the corridor in question. This is a lot that has a long, narrow corridor leading in from Pulpus Road to the area in the back where where her house and cottage are located. And so therefore, and the other houses that are adjacent to it have utility lines running through that corridor. It's going to be an interesting job to do, and there can be unforeseen consequences when they get into doing it. What we would like to suggest, we're not asking for a variance. We haven't filed an application for a variance. What we would like to suggest to the board would be that there would be a stay of enforcement of that order, that the board simply not undertake any enforcement of the order and set it aside so long as, on an indefinite basis, so long as Ms. Hutton is continuing to reside at the property, in order to enable her to stay there, not have to leave the house that she's been in for many years. She's a person who's lived in Nantucket all her life, her adult life, entirely as a resident of Nantucket. And we therefore would ask that the board consider the hardship that would be involved here and, as I say, stay the order, not give a variance, because I think that it could be a problem for you to do, but rather that the order be stayed to give her the opportunity to continue to live in the property as I've described. She's here with me, as I said, tonight, and obviously happy to discuss any of what we're talking about.
I'm not on. John?
Yeah.
I know there's no variance request, so, and we know that that would have been a very difficult thing to deal with because of where it's located. Stay of enforcement, I mean, is that, I mean, I can't say I have lots of experience with that, so I'm asking for your opinion, how you folks handle that kind of stuff.
Right, yeah. So our office issued an order to connect, and I believe a citation as part of the enforcement for this property to connect to town sewer in as part of Chapter 332 connections to sewer. When sewer runs by properties, the obligation to connect to town sewer. We found that this property had not done so. Actually, I had found out back in 2021 or 22 through a food establishment plan review that it wasn't connected to town sewer. And at that time, I let them know that they did need to connect to town sewer. And at that time, they applied for a variance not to connect. And that board at that time granted a 2-year variance for the connection to town sewer. So about a year ago, we noticed that the connection still hadn't been made, so the enforcement order went out for the property. So yeah, actually what this is just an appeal of the order that our office sent out. So they're appealing the order in front of you. It's not a variance request. So in essence, it's either uphold the order or throw it out and let it not be enforced.
Well, not so much throwing it out. I mean, it's just kind of stating that it's hold harmless, just hold things the way they are with the conditions of as long as that is living in the house that,
Right.
And I think we would, and Arthur, you can help with this. We wouldn't want to see property transfer. I mean, we would like to see that it's her house, and then at the point that she's not there, that it's a new owner's problem type thing.
Yeah, I mean, the point would be to let the situation stay as it is at the present time. At such time as she's no longer living in the property, then obviously you can revisit it and either connect it, or somebody at that time could apply for a variance or whatever. But the point is to put it on hold, stay it. We're not asking you to eliminate the order, but rather to hold enforcement so that the situation can remain as it is. We don't question the fact that that this regulation is in place and that the order was legitimately issued, but rather that enforcement would be, under the circumstances, inappropriate as a hardship.
Okay, thank you. Board, any questions or thoughts?
I have some questions and perhaps some thoughts too. I have been following this, and I did read up on everything. In terms of just like legal authority, and staff can help me with this. I know that the verbiage says, the regulations say no variance, and I know they're not asking for a variance, shall be granted in environmentally sensitive areas. Is that different for like a stay the order or hold the order from a legal standpoint?
Technically, I guess by word variance, yeah, no variance shall be granted. Yeah, and that's not what's before you. It's really the appeal of the enforcement order that we issued from our office, in line with the regulation, obviously, to connect.
And just to confirm, the new septic was placed on that property. It was 2014. Is that right?
I think it was just a new leach field that was installed in 2013.
Or in 2010?
I thought I read 2014.
No.
Is that right?
I think that
Thought it was.
in 2010, as far as we're completed, I'm not.
But it's functioning. It's been tested as functioning and working.
Yeah.
I have a hand up if you recognize that.
And is it a conventional system or is
It
it
is, yes, conventional, yep. Heather, you have your hand, sorry. Oh, guess not.
Hi, sorry, can you hear me?
Yep.
This is Heather Hudson. I'm speaking as just a resident in Nantucket, which is also a part of watershed regulations. I just wanted to speak my opinion on this. I and all of my neighbors, we all are under these enforcements. We put in a system that cost us $106,000. I work for the town. My husband's a chef. You can imagine how much money that is. And I just want to be careful when we're thinking about regulations, is that they are in place for a reason. And I mean, I have neighbors that are also, in their 80s that have these letters in the Nantucket area. And I just feel like if we're going down the line where we can just say it's hardship and the letter doesn't count, then how many letters are we going to go back for? And I mean, can we go back and say that the lien on our house is, we don't need to pay it because it gives us hardship as well? It's a lot of money. Our mortgage was about $5,100. Now it's about $6,200. So I just want the board to consider that. Thank you.
Sir, identify yourself and address.
David Gray, sewer director for the town. I just have some timelines I want to take and just make sure everyone's aware of when we did this project. The Nantucket Harbor Shimmo Plus project was done in 2017. It was about a 3-year project for construction. Everyone in the area was given notice. Everyone was given sewer connection forms to take and state where they wanted their stubs left at each lot, which most folks did. The town was going to provide up to 2 stubs for every single lot that we passed by. If we didn't get any response and we had lists of people that we didn't get responses from, we would just put the stub in the driveway. Because we didn't know where the septic was on the lot, we would leave it in the driveway, which we did. So in August of 17, the initial stub location forms went out for everyone to take and that was a group 1 and group 2. In availability of sewer was notified when most people in group 1 and 2. It's one was in August and the other one was prior to that was in April of 19. We had some issues because of COVID. We had given some extra extensions on time up until August of 20, or in February of 21 on one of the other groups. It wasn't to take and create hardships on folks. I know that even the Ms. Ennis was at one of the meetings that we had, the public meetings. They all knew what was coming. There's tons and tons of information on our website. About 95% of everyone, the 460 plus connections that were in that area have connected. Some recently just next door to them to the east, as well as, had long driveways. I know that one quote was received from one of the local contractors. We have 32 licensed installers on our list. I don't think one quote from one vendor is maybe adequate to take and find the number. I find $100 and something thousand to be awfully steep. After being at this for over 18 years, maybe some more quotes would be reasonable ask. But I just wanted to kind of get out there the timelines and what we did and public outreach and meetings and neighborhood meetings. So this has been ongoing since 2017. Soon we're going to have the Somerset project coming up, where there could very well be some driveways that are over 500 feet. And if we start something now, I have a feeling it could snowball. And that's that. I just wanted to get those dates and times out there that of what we've done. We have all the certified copies of every letter we ever sent to everybody. Voicemail records. So it's one thing about the sewer department is we're very record dependent, and we over document everything. So just so that everybody knows that
Okay.
we did what we could do as part of the sewer department. We knew when we did the Schimmel project that there was no way in 2 years we could get 400 plus connections done. So we gave them an extra year, and then COVID and everything else happened. But we do now currently have 32 active and approved installers on our list. We didn't have that near that many before. Just a few comments on what's going on.
Okay, thank you. There was one comment the town council made. Say,
How many times have you been before the board?
Or,
Four.
four.
yeah, I requested a, variance because of my commercial kitchen. I then broke my hip. So my commercial kitchen is now, I've decided to have it, it's no longer in service. And that was just before the 2025. And then, so my son and I appeared here in 1 September, then we came back, this is 2025. Then we came back in, I think it was November, I think, and then, or maybe it was January, and then in April, and then it was delayed until I got Arthur to agree to handle my case.
Thanks.
I also wanted to say
I
something.
think it's tough that you've been here 4 times and there's really been indecision about what the answer is. I think that, and that we're a new board, and
I also want to say, as far as, excuse me, as far as other, getting other costs to this, I'd have to start with $10,000 to be able to do that. So I don't care who it is. I mean, and
and then for an engineer's plan. So even to do that and before I even start to get costs, and I don't want to get into technicalities of why this is going to cost more, way over $125,000. But there's our reasons. And that was and that even from Tuscana, their office that didn't even cover. That was just a quick estimate for the board.
I can understand the costs
Yeah,
Pretty-
I know you do. Yeah,
pretty well.
yeah.
You guys have a suggestion?
No, at the May meeting, and again, it wasn't in relation. Sorry. Yeah. At the May meeting, the May 21st meeting, it wasn't in relation to this, but and I guess relation to another discussion we were having, town council made a comment that a self-created hardship does not meet the threshold for hardship. And I'm not sure if that's an issue we're dealing with, or or if it's just a matter, to stay. Ms. Hudson's concern that if we do it here, and at the concern of sewer department, do we, is that kind of like a slippery slide type thing? The board's been struggling with it since. I mean, I can't say that we have a clear path. We knew that we couldn't do a variance, and that was pretty much because the regulations pretty much state you can't. But this isn't a variance request. This is, like as Arthur said, this is a request essentially. We know it's there. Leave it alone. At the point that the property transfers, it has to be done. And again, whether it's transferred to family or someone else, it would have to be done. And I think that is pretty much, I think, what we're before us right now.
We don't question the fact that the regulation exists, and at some point this is going to have to be connected. Simply as I've been explaining, it's a question of the hardship, financial hardship that affects the present owner. I can say that, obviously I think that the extent to which this is obviously the concern with the sewer being there, in addition to the fact that you want it connected for obvious reasons, is the concern about the harbor. It was set back a considerable distance from the harbor. I think that the likelihood of and with a relatively small amount of use, that the impact of this upon the harbor is small. But that's not the issue. The point is, once again, the hardship is extensive and serious. The conversation I had with the trust officer today was not one that left me with much hope in terms of any ability that she would have to be able to work out any kind of arrangement to comply with the order. And as such, I think the only approach, and the approach that we're taking, is that we ask that you stay the order, not enforce the order, put it aside, and then obviously deal with the issue at such time in the future as she's no longer occupying the property.
Has this ever been done? I mean,
The stay of enforcement.
yeah.
I mean, not since I've been, I mean, I've only been 5 years. So, I mean, during that time, I don't think we've had that request. We've had lots of variance and juggling, but not like just a stay of enforcement. So I can't offer you much, insight to that. I mean, John, I'm not sure you've obviously got a lot much more of this. Has the board done this before is kind of, I think, the question.
As far as allowing
Well, it's,
the not.
yeah, I guess just.
So I know of 2 situations in the wellhead protection zone that were in Rugged Road. I believe actually both neighbors, where the board at that time did allow it with certain restrictions, whether it was basically kind of the Nantucket Harbor watershed regulation or Nantucket Harbor watershed, property transfer, failure of system, building permit. I believe those conditions.
The
So,
additional triggers we
and
use.
where the run was 600 feet or so.
So if we were to put a stay in place, we could put restriction on like the system has to remain functioning. One, no additional building would happen. And if the property transferred to anyone, including a family member, at that point, it would have to be enforced. We could do that.
You could, I mean, yeah, you could set that restriction, yeah. So two other things I guess I would bring up is this situation is eligible for the septic loan through the septic loan program. This is kind of exactly why this was put in place by DEP and the Board of Health years ago. And second, with that said, since this is in the Nantucket Harbor watershed, it's subject to, and a conventional septic system, it would be inspected once every 5 years would be the requirement. So
The system that's in place now.
correct.
Could we up that?
Yeah.
You can.
Ms. Hutton, when was the last time the system was fully inspected by, and do you know offhand?
Visco came out to take a look at it, and when he was on the board, I believe, on 2023, and he came out and pumped everything and said he said it was fine.
Okay.
And that was one of the requirements about my commercial kitchen, and so it was, everything was inspected, and he approved everything at the time, as far as I know.
Yeah, I think that was 2022 or 23.
Yeah, I
It
think
did,
if I look
it
at the
did pass
notes.
inspection at that time, I recall.
Okay.
Just some thoughts. I have been at meetings where I have seen you come before the board. This is a really tricky one. We're going into 2027 in 6 months. This has been going on since 2019, just short of a decade of the same conversation. The hardship is not going anywhere. You are a resident in your 80s. I find it challenging as a human being to continue. If you have a working septic that has been assessed and there's not an issue there, I think I'm, kind of what Bobby was saying, I would be open to having discussions of whether they're called regulations or stipulations that we would put in place if we do the order. I really think it's time to take the conversation there. Outside of that, John, I don't know what the loan offerings would be or what.
The problem is you're still going to pay it back.
Right.
If you don't have the revenue,
It's added to your tax bill.
So the only thing that really seems to make sense to me is to put in stipulations, regulations, whatever we're going to call them, and to grant the request, what you're asking for. This has been ongoing. Like I said, it's going to be coming up on a decade. So I think we can be very careful with the wording that goes into that. But outside of that,
I would want, for me, I would want to see the system is inspected, pumped and inspected once a
Absolutely.
year. No additional building is done.
no conventional kitchen going back into,
Right.
I think there would have to be very clear.
No new construction at all. really.
No new construction.
And understand that
Any change in ownership, including family. And when Inez is 147 and she finally dies, then someone else will have to put the system in. So
Can I just bring up one thing I think we should think about, because just of what we're deciding to do. There's no mechanism in place when someone comes and says, I have a hardship, to prove that they have a hardship. So I'm not saying you don't. I'm not saying that we're not all thinking about that. I'm just saying there is no mechanism to prove it. And I think that makes it a tough decision, because there's a level of trust that we're having, that we're not going to look foolish.
Well, I mean, Arthur, I mean, you know, we're trusting, we have our trust in you, and that you have talked to the trust officers. And, in terms of her financial condition and stuff. And what you've relayed to us is that there is not a cushion there of being able to absorb a cost of this.
Yeah, I mean, as I say, what I have is the conversation that I've had with the trust officer, the information I received from the client, then speaking with the trust officer. Again, the first words out of the trust officer's mouth was, Inez is in a dire financial situation.
Is that in writing anywhere from
That-
trust officer?
That took place. I missed connections with her all day today and spoke with her 10 minutes before I came to the meeting. So that's
Just to
that,
you know what.
but I will I will certainly assure you that those are the exact words out of the name of the trust officer.
I think this is one of those rare situations where you have to take each one individually, and if we do get more of them, we have to just be very scrutinous.
Yeah.
When
Well,
we
I
look
think,
at them.
I think that's Ernie's question was, what is our scrutiny level? I mean, how,
Yeah.
where is that? And again, just go back with town council and again, it wasn't related to this, but he said that a self-created hardship isn't grounds for a hardship. So.
But just confirming that wasn't in regards to this case.
So
Just
again,
clarifying.
it was not in regards to,
For my own.
it was in the course of that meeting that he, made that note.
I
It
think
was
the
like,
key for me is that we're not eliminating the requirement. We're just prolonging it. So,
We're granting grace essentially.
yes.
And right, it's not going to
With
go
condition.
anywhere, transfer to.
Conditions, correct.
And, I want to make it clear too that he had mentioned, when Somerset, again, that's being scrutinous is why we're here. And that's not something that's going to just willy-nilly in the future. I respect Heather's comment as well, what she said online. And so I think this is a very unique, from what I have researched and been, privy to hear you in meetings, a very unique situation. This isn't going to be, I don't think we're going to see situations like this extremely often.
Yeah. Arthur, would you be willing to send like an email to John, just relating your conversation with,
Yeah.
just so that we have
I
something.
can obtain, I know, a letter from the
Okay.
from the,
just so
from
that,
the back officer.
if we're going to go forward, again, it's establishing that there is, that we aren't just going by emotion, that
Yeah.
there is a concrete basis, and that we hopefully don't get these again. But, if we do that, that these are tough decisions, and that we would like to be able to say, no, we based it on reality and not on emotion. And yes.
This is just more of a discussion of the general implications for this kind of decision for enforcement down the road, because it now creates an incentive structure where delaying compliance with a regulation allows you to make a case that you should not have to comply with the regulation. In this instance, there's every indication that this is a genuine hardship, but it would have been a lesser hardship had there been prompt compliance with the regulation in 2017. So as a consequence of that, it has implications on the Somerset sewer extension, and it also means that we'll need to work out some more rigorous definition of hardship and have some mechanism by which we verify hardship. In human services, when you are getting a means tested aid or support, you provide financial documentation of your status. And we will probably need to work with town council to work some way out for that, because it is a somewhat perverse incentive structure where not promptly complying with a regulation, which is good citizenship, lets you delay or not have to comply with that regulation under certain circumstances.
Yeah, and one of the things that I thought for down the road, and I don't know if this is even a possible thing, is that where you can use the sewer loan process, because that's how I did my septic system, and it comes on my tax bill, is in the case of a dire hardship like this, could it be used and then somehow put as a lien on the property? So when the person dies or the property transfers, then it would be paid from the sale of the property. So in other words, it would still be installed through the process, but instead of it going on the tax bill every month, every year, it would go on as a lien on the property. So when the property transferred or was sold, it would then be paid with interest, obviously, but it's a way to possibly do this because we are going to have people that are going to have a hard time financially coming up with this money.
And there's plenty of very good reasons to have those hardships along the way. That's not my concern here. I know the betterment loan program is regulated at the state
That's
level.
state.
I'm not sure if that lien process could work here. We can investigate that.
Yeah, I mean, it is state, but I know that, again, we've had, as we've, not just for this case, but, just in general, especially when we talk about the regulations changing, that the town maybe needs to look at having a more flexible, same type of program, but something a little more flexible.
Like our own betterment program.
Yeah,
that
that
we
fills in
could-
the gaps, because the state program has lots of rules to it, and it does
Yeah.
keep certain people out of it that really
Right.
might need a mower.
Right, and this could be, this is gonna come up, I'm a big proponent of sewers, especially when it comes to our watersheds. I think it's one of the true services that we as a town should give as many people the option to do, but there are situations where it gets very expensive, and, it'd be one thing if Inez's septic system was failed and we were trying to give her a variance for a system that's not working, but she's got a working system, which is one of the reasons why I want to make sure it gets pumped and checked every year. She's in the house by herself, except for her son and his wife for a couple of months a year. So the amount of waste that's going in is very minimal. It's not like there's 12 people living in there. So, but it's something I think we should look at down the road, is maybe setting our own type of betterment up where we can help people that can't afford to hook it and still get the houses hooked in. And then when the house transfers down the road, that gets paid by the next owner or the relative who inherits the house, So,
I want to add one thing I would like to say is what also sparked in my mind when I was thinking about this is it's not just the expense of the installation. It's the maintenance of it and it's the monthly bill. I was really thinking in my head, if your budget is 5,000 a month with Social Security and whatever you have, if you're taking, $100 to $500, depending on the property, that hurts your budget. So, and you don't get raises in Social Security. So I think it's a real thing to think for, especially older people.
I agree. And that's why it is a little tricky. There is a human aspect to this. This isn't, a younger family. It is unique in that situation,
And then, so, sorry, maybe you're thinking of something different in terms of the loan and liens, but as part of the betterment program, a lien does go on the house. So along with, the payment goes on your taxes and there's a lien put on the house.
I get it, but if you don't pay that extra amount on your taxes, then there's
Foreclosure can
consequences.
happen, yeah,
Yes.
foreclosure can
Right.
start. And I think it'd be, I'd have a mechanism that says upfront, this is how it's being structured. It won't be on your tax bill. But
Okay.
again, that would be something that the town would have to set up independent of the state system, because that has rules that we do. So,
Sorry, I have another hand up.
okay, go. Yes. Right.
Heather?
Hi, I just have a question for the board. So, the betterment loan, like John said, is a lien on the house. So I have a lien on my house that gives us a hardship as well. I'm just wondering, so can we just pause it as well? So that would be a question too. If you're having a hardship and you already have a betterment loan lien on your house, can you pause it when you feel like it? So that's just one question I have. And then also too, I just want to make a note that not a lot of us either have accessory dwellings that to rent in the way that Inez does. You can rent a cottage and use that money to pay your loan. So I just wanted to throw that out there as well. But I just was wondering if that would be considered for people that have, like myself, that have put these massive liens on our house that creates hardship, if we can now pause it, if that goes into effect. Thank you.
Whoever manages a loan betterment program would be able to answer that if there's a mechanism, but.
That's a state.
And again, it's state money coming through local communities, and Nantucket participates in it, but we participate in it according to state guidelines. And there are a couple types of installation situations that it doesn't cover, which is problematic. What else you got? So Arthur, would you be able to get the letter?
Guess I have another
Will.
hand up, sorry.
Oh, okay, sorry, another hand. Sorry, but
Tamika?
Yes. So unfortunately, working with the finance department, there is no pausing. The regulations from the finance and with this loan program is if it's not a sale of a house and you're paying the loan completely off, then it's basically you're not that there's no pause for it. It's even like with the ACO loans that we have, trying to even give them their money back for those who thought that they were going to get the sewer coming to the Robert Hart shed. They had to, put a lien against their house, or I mean, add taxes onto their stuff, and then add money until they thought that process was going to go through, but it did not. Then they're now getting their money back. But as far as the betterment loan, there's no pausing it at all. It's a sale of a house or a transfer of a property. And when that transfer of property happens or the sale of the house happens, that loan is paid off right then and there. But we don't pause any far as financial.
Okay, no, thank you. Yeah, that's kind of, I think, what we thought, that the state program is strict. That's a separate discussion, but I think it's one we want to maybe help keep live with the town, and as our select board representative, that, to kind of, can we do that? Because and actually we did it already with the Somerset one, where we are paying for hookup fees. I think that was added to town meeting.
No, we didn't pay for, we took the betterment out.
Okay.
We took the betterment out, but they're still gonna have to pay their hookup fees. This is what a lot of people didn't get, that when you go to town meeting and you vote in a sewer district, then if the sewer runs by your house, you have X amount of time to hook into it. And everyone doesn't realize that you just don't run a pipe out from your house to the street and hook it in. You got to get an engineer, and the engineers are backed up, and they're not cheap. And then you got to, I mean, Ernie, what's the cheapest one you've ever done? 50 grand, 75 grand? It's not,
It's not cheap.
no. So.
Okay. Discussion for future, but I think that
Yeah.
one we got to try to keep alive, so that we really, like you said, we got to protect the aquifer. And we want to not bankrupt people. It might inconvenience them. We don't want to bankrupt people. We want to have flexibility in plans available, and also we are putting together a document about tax relief and stuff like that, but that's independent. Back to you. So if we can get the letter from the trust officer, as much information as they're comfortable just to kind of document, because again, we're concerned about being able to have a defensible stand.
Yeah.
It would have the condition of a yearly pump and inspection of the current sewer system. No new construction other than emergency repairs.
Right.
So no adding anything. I mean, obviously, if something breaks, got to fix it. And that any change in ownership, whether it's within the family or outside of the family, would end the enforcement stay and require essentially immediate hookup.
Fair enough.
The motion, I guess, is to grant an enforcement stay based upon 1 year yearly pumping and inspection of the existing septic system, that there'll be no new construction except for emergency repairs, and that any change in ownership, including family, will end the stay of enforcement and result in immediate hookup. And in the background is that Arthur will just get us documents that will.
I think you might want to
correctly.
put into the decision also specifically that it's because of demonstrated hardship of the applicant, demonstrated financial hardship of the applicant. I appreciate your concern about creating a precedent, and obviously you want to make it as clear as possible that it's unique to the facts of this case.
Yeah, so actually adding the clause, whoever the minute taker is, demonstrated financial hardship. And again, in this case, we will get a letter from the trust officer that shows essentially the statement, the condition of the account.
Right.
And where that stands. So if that motion is
specifically on the letter, if we get like a balance information. Like if we specifically get balance information, because it's.
So would that be, if the trust officer described the dire financial situation, a number behind it, so that it kind of the statement has meat behind it.
Yeah, and I'll get that to staff as soon as I can get it.
Okay, yeah,
And then
yes.
obviously, if you have any questions about it or need anything further, let me know. But
Okay. Okay,
that
no,
should do
thank
it.
you. Okay, so the motion is, again, the pumping, no new construction, change of ownership, demonstrate a financial hardship. Arthur will get the information that will hopefully, clearly address the financial hardship issue. Is there a second?
Second.
Okay, vote.
Ernie, aye.
Okay.
Aye.
Aye. Aye. No.
Thank you very much indeed.
Day of enforcement.
Thank you.
You're welcome. Some of these are hard. No, well, not, but it's hard. I mean, living on the island. had
Lots of people
costs and-
struggle with it.
Okay, so,
Holding off on
welcome to the
the-
Board of Health.
Right.
Off on
Um,
the, is that it?
that's it from our agenda. If you have any parting thoughts, if not, we'll make a motion to adjourn.
So moved.
Anyone will second that?
Second.
Second.
Okay, this meeting is adjourned. Thank you.
Jericho.
Thank you,
But-
Chair.
Who does?
Thank you.
To me.
So,
You, Don, put them in.
What was your question?
John Carmel waving at you.
Hold on one sec. We'll just clear up that.
Waving at you.
I can't. So like, let me show you. Cause I downloaded it and then if I go this. and I
There we go.
on Facebook. So let me show you.
Well, I think they're
Yeah,
not,
the
they
full
keep
thing,
taking them
right.
again.
So let me show you how my, so
Yeah.
when Eric
Oh.
sent us that